Hi everyone, Dr. Emi from Pain Free and Fit. Today, a great exercise for those of you with herniated discs, degenerative discs, and bulging discs at L5-S1 and L4-5 in the lower back. We're going to be going over a wonderful exercise to recruit the multifidus muscles and change the curve in your lower back to support posterior disc healing. Hope you enjoy. Research shows that many cases of disc herniation are associated with a weak multifidus muscle. The multifidus muscles, remember, run from the center vertebra right on the bones in the midline of your spine, down and out. They connect 1 to 4 to 5 vertebrae at a time and help to check or hold the vertebra in place so that when you move, the vertebra doesn't have an abnormal movement. It doesn't shear and compress that disc as much because it's held in what's called extension, which is a slight arch in the back, avoiding the flexion or the flattening of the lower back and compressing the front of the disc, which aggravates the most common type of disc herniation, which is a posterior herniation, where the fluid on the inside, the nucleus of the disc, is moved backwards. Compression, sitting, bending forward, moves that fluid back. It pushes into the posterior back wall of the disc, aggravating symptoms. So to undo that tendency for that herniated material or that nucleus to push back and to assist its movement or migration back to the center, more forward to the center portion of the disc, relieving pressure on the back of the disc, relieving symptoms and herniation, and allowing the outer fibers of the disc to heal. Remember, the outer fibers get circulation, they can heal. The majority of the disc cannot heal on the inside because it doesn't get circulation. But many times those outer fibers are what's causing the majority of your pain because they're pain sensitive. So this exercise today is based on improving two things. One, the multifidus muscles, increasing their strength, waking them up, building their endurance so they can hold the spine at a better position and resisting that flexion. And two, assisting the body to, within a pain-free range, increase that arch of the back. Specifically for L4-5 and L5-S1, that's a little different than higher in the lower back, because here what we want to do is we want to increase the tilt of the sacrum. The sacrum is that slight triangular bone that sits between the two pelvic bones, and it's the base of your spine. It's what that L5-S1, S1 stands for sacral level 1, sits on. So by increasing that tilt of the sacrum and the pelvis anteriorly, meaning the tailbone is going to go up and the pubic bone is going to go down, you'll feel an arch in your back, you actually support a mild compression on the back of the disc, which then pushes that fluid that's moved backwards more forward towards the front of the disc, relieving symptoms and assisting in healing. So we're going to target the multifidus and that in one exercise. And here it is. If you feel your multifidus, take your thumbs and go to the midline of your spine in your lower back. You'll feel those bones that are there, those knobs. Pick any one you want, but try to pick one of the lower ones that are closer to where, for instance, your belt level is. That's going to be L4-5 or L5-S1, just a little lower down. And on that knob, I want you to feel both to the right and left sides of the lower aspect of that knob with your thumbs. So both thumbs are pushing inwards into that bone on the right lower corner and left lower corner. You're going to feel the multifidus, which comes right off that area, contract when you, from a standing position, move your hips straight back. At a certain point of moving your hips straight backwards, you're going to notice your hips are moving backwards. Your upper body starts to tilt forward. It's not because you're bending from the waist or changing the curve in your back, but from the hip joints, the ball and sockets of the hip, the whole body starts to rotate forward from above the pelvis. And as you do that, you'll feel that bulge of the multifidus on both sides. So we're going to use that as a strengthening exercise, and it's also going to help support the anterior pelvic tilting, which is that arching that we need to push that fluid back forward. And the reason that occurs is because when the hips move backwards, it causes a slight anterior tilt. You'll notice that as your hips go back, your pubic bone will move down and your tailbone will move slightly upwards. On the other side of the coin, the actual lower back vertebra, L4 and L5, actually flex forward. So you may be thinking, why would I want to flex more forward? Isn't that going to cause more compression on the front of the disc and cause that herniated material to move more backwards into my bulge or herniation? Well, the bottom line is that even though there's some degree of flexing forward at the L4 and L5 vertebra in the motion of bringing the hips back, the anterior pelvic tilting occurs much more. So the net effect is we have much more extension or anterior pelvic tilting than we do flexion, and we get a resultant net extension or arching in that lower back, which supports the compression on the back of the vertebra, helping that disc material to migrate forward. So we're going to use a little resistance to do that, to strengthen our ability to have the multifidus muscles increase their endurance strength so they can hold this for longer periods of time and during heavier activities, as well as the movement will be assistive in moving that disc material forward. So we're just going to take a power band, loop it around our hips, around the level of the greater trochanter. That's the side of your hip bone that you can feel on both sides. And you're going to put that over an anchor, step back until the tension is out, engage your RPI. That's your neutral spinal position. If you don't know what that is, you need to figure out what your spinal stability issues are, what your posture and movement issues are. You need to engage all the muscles in the right alignment. Learn that at painfreeandfit.com. We have a number of body analysis techniques that help you determine that. From this position, we're going to move back until the tension is out of our band, and we're going to, as we palpate our multifidus muscles or feel those multifidus muscles, we're going to move our hips straight back. Now you notice I'm not moving my chest forward or head forward or my feet. It's just the hips until I feel the multifidus contract or tighten under my thumbs. Hold it for a moment and come back. And we're going to repeat for repetitions like that. Very simple exercise in the standing position. There's very little discompression because we're not sitting. Our spine is actually increasing its arch, so we're not bending forward. So for those people who find relief with extension or arching the back, this is a great exercise to include. You can do it for repetitions, building up to high repetitions. Remember, the multifidus is a spinal stability or type 1 endurance fiber, so we want to build reps up to 50 to several hundred. Or we can increase the isometric hold time, meaning that we can increase the time that we spend in that position as the hips are back and the multifidus is contracting. Plug this one into your routine and you'll be really helping to not only increase the strength of the multifidus muscle, which will stabilize your spine, but you'll notice that after a few sets of these, your lower back many times will feel better because you've migrated that disc material back to its more normal central position. Questions or comments? Write in. I'll do my best as always to answer your questions. Feel free to subscribe to your channel if you want to learn more great videos about disc herniation exercises, degenerative disc disease, and disc bulging. And remember, if you're looking for a great program to take you step by step in determining an analysis of your body, what your body mechanics are that are disturbing your disc, spinal stability issues, muscle imbalances, movement and posture abnormalities, and learn how to correct those with a tailored program for you that takes you step by step into building up the strength of your back and assist healing, check out our Fast Track program for degenerative disc disease. It's applicable to herniated discs and bulging discs as well, available at painfreeandfit.com. I hope this video on multifidus and anterior pelvic tilt training with hip retraction helps you with your L5-S1 and L4-5 disc herniation exercises.